Dennis, why don't we go ahead and get started?
Okay. Good afternoon. I'm Dennis Galucki, wishing everyone a happy new year and welcoming you to the 481st Imagine Greater Buffalo program and our 103rd virtual Imagine lecture hosted by our wonderful Buffalo and Erie County Public Library. Thank you for joining us today. This program is created by the Center for the Study of Art, Architecture, History, and Nature, or C-SAAHN, as I call it, and ImagineLifelongLearning.com. Now, before we get started, just a little housekeeping. Everyone watching will be muted and your video turned off. If you do have a question or comment, please, you can type it into the chat box and we'll go through them at the end of the presentation. We are recording this program so you can watch it again later on the Downtown Central Library's Facebook page and their YouTube channels. And we hope you share the link with your networks and friends. Now, on to our featured speaker, Dr. Timothy Murphy. As a physician scientist in infectious disease, Dr. Murphy's research focuses on bacteria that causes otitis media, ear infections, in children and respiratory infections in adults with COPD. Funded by the NIH, his work focuses on identifying how these bacteria cause disease and developing vaccines to prevent these infections. Dr. Murphy is also director of the UB Clinical and Translational Science Institute, which provides support and expertise to perform clinical and translational research through UB and partner institutions with a vision to improve health and reduce health disparities in our community and in the nation. In 2019, UB launched the UB Community Health Equity Research Institute that will conduct research that addresses the root causes of these health disparities while developing and testing innovative solutions to the social determinants of health to eliminate health inequities in our region. Dr. Murphy is privileged to serve as director of the Institute, which includes faculty from 12 UB schools and works closely with community partners. Wow, very impressive, Dr. Murphy. Let's hear what you have to say about the wellness of Western New York.
Thanks so much, Dennis, for the invitation to speak here today and for the nice introduction. I'll share my screen and I'm going to shoot for talking for 20 minutes or so, and then leave time for questions and discussion afterwards. So I'll start here and we'll go here and then here. All right. So as Dennis mentioned, one of the roles that I play at UB is director of the Clinical and Translational Science Institute. And what I want to talk about today is clinical research in Buffalo and why should we care about that? And what role does that play actually in wellness in our community? And so I'm going to talk a little bit about the Clinical and Translational Science Institute as I do that. Okay, next. Does not seem to want to advance. Oh, there we go. All right. So the CTSI, as we like to call it, the Clinical and Translational Science Institute, includes our building that I'm in right now, and that's the Clinical and Translational Research Center, which is in the bottom left there. The top half of that building is the UB owned and operated Clinical and Translational Research Center. The bottom half is the Kaleida owned and operated Gates Vascular Institute, or GVI. So we share a building. One is for healthcare on the bottom, and the top is research, and we partner and work together closely. We are supported by a large grant from the NIH and also by UB and our partner institutions. And then we have formed the Buffalo Translational Consortium, which is a partnership of 20 institutions that I won't go through each one of them, but they include the health sciences schools, 5 of them from UB, clinical partners, Kaleida, ECMC, Roswell Park, UBMD practice plan of the School of Medicine, and several research institutes, and several valued community partners, because our research is tied to our community. As noted in the next slide here, so the vision of the CTSI is to perform clinical and translational research to reduce health disparities and improve the health of our community and the nation, as Dennis actually outlined in the introduction as well. So let me talk about the potential benefits in participating in clinical research. So we, have a goal to engage our community in clinical research, and we want to engage our entire community in clinical research, as I'll tell you. That's going to help contribute to raising the level of overall health and health care in our community. So why would anyone want to participate in clinical research or in a clinical trial? Well, it allows you access to treatment that wouldn't otherwise be available. I'll give you an example, and that is Mick Jagger, who is the lead singer of the Rolling Stones, actually had an aortic valve replacement, if you'll recall, a few years ago. So now the old way to do an aortic valve replacement, or in some circumstances it's required, is to do an operation where the entire chest is opened up, and it's open heart surgery, if you will. There's a new way to do it, and that's through an artery in the groin. It's called TAVR, transcatheter aortic valve replacement. So at the time that he had his valve replacement, Mick Jagger, the only people who were approved by the FDA to have that was people who had very severe disease, and similar to the regulatory agency in the UK, the analogous one to the FDA. So he could not have that unless he participated in a clinical trial. They were doing trials to see if it was also beneficial to do that in people who were at lower risk, in other words, who are not at 50% death in 6 months or something like that. And so he was part of a clinical trial to have his very successful aortic valve replacement. If you've seen him dancing around on a stage since he had that valve replacement. Another benefit is regular and careful attention from healthcare professionals. So particularly people who have not been connected to healthcare, clinical research can actually help them get connected to healthcare for the problem that they're in the study for, or the issue that they're in the study for, but then also can make connections with primary care providers and other providers. Treatment may be free or low cost. And a great example at UB a few years ago, treatments for hepatitis C, fortunately, are now covered by insurance and Medicare and Medicaid. But prior to that, just a few years ago, insurance companies were not covering that treatment. That was $30,000 or $40,000 a year in cost. So many people didn't have access to it. However, one of our investigators here was doing a clinical trial in which people got treatment for free, treatment that we knew worked, but they had to go through some extra blood tests and so forth, but got this $40,000 a year treatment that we now know to be curative. You receive expert medical care at healthcare facilities during the trial. In fact, that's what's part of being in a trial is the healthcare that goes with it. And we know also that outstanding healthcare goes hand in hand with outstanding clinical research. You understand your disorder or your general health better. You contribute to research that may save lives and improve health in the future. And you're also taking control of your own care as well. So I'd like to show a 2-minute video that will show you an example of a woman who participated in a clinical trial related to smoking cessation. See if we can make this work.
When I was pregnant with my little princess, it was the hardest pregnancy. Still smoking, doing probably 10 to 15 cigarettes a day. I knew the damage that it was doing, but at that time I just felt hopeless. I didn't feel like I would be able to change anything.
When we talk about smoking during pregnancy, we know people with a low socioeconomic status, such as people living in poverty or with a low education level, have much higher risk of smoking during pregnancy. So we are talking about like 2 times or even 3 times higher. So it's a big difference.
My experience with the study was completely 100% positive. They give you pamphlets and you take little quizzes. You see the risk of, if you continue on smoking, this is what's going to happen. And I realized, it's like they're smoking a cigarette right along with me.
Besides education and counseling, we also do 2 biochemical tests. If the mother even stops smoking for 1 day, we can see the immediate improvement. So a lot of mothers are so excited to see that.
She was like almost 7 pounds, but I knew a lot of that with the weight gain had to do with me not smoking. She probably would have been way smaller than that. I looked down at her, the most little precious little thing that I seen. No breathing problems, no other problems, and I was thankful for that moment of not smoking whatsoever.
This is big reward part for me, so we can make a difference in the mother's health and also the health of the next generation.
It's almost a year and a half that I haven't picked up a cigarette. I save more money, and it's better health environment for my kids.
So to me, that's a pretty compelling example of the pluses of being involved in clinical research. And in fact, in that study, everyone got the counseling and so forth for smoking cessation. The difference in the two groups was that device that that Dr. Nguyen talked about, and to see if people who saw that number improve as they quit smoking, if that was a better motivator, did they do better? In fact, the study showed that yes, that's a good motivator for people in terms of quitting smoking. Well, people worry sometimes, oh, I'm going to be a guinea pig. What are the potential risks? So it's important to recognize that there are some potential risks. One would be the potential side effect of the experimental treatment. For example, if it's a new treatment, then maybe there'd be a side effect. It may not be effective. You may go into the trial and you may not get any benefit. And then there's often increased time commitment and effort, including trips to the study site, more treatments. Sometimes in some studies, you end up having to stay in the hospital. Those are, more detailed and extensive studies and so forth. So there are potential risks. And then overall, if we look at people who participate in research, they have better health outcomes, have more cost-efficient care, and are more satisfied with their care compared to people who don't have the opportunity to participate in clinical research. So, and that's from that list of things that I showed you about, being connected with healthcare and so forth as part of clinical research. So, if you remember what our vision was, our vision in the CTSI is to do research to improve the health of our community and to reduce health disparities in our community. And we live in a community with high health disparities, particularly people of color. So this is if you look at the 2020 census, you can see the direction we're going in, but approximately half of our population is considered underrepresented minority. So in many ways, actually, we are a population of the future in Buffalo, in that the census projections are that in the year 2040 or thereabouts, the entire country will be approximately 50% underrepresented minority groups. And interestingly, nationally, less than 10% of participants in clinical trials are underrepresented minorities. That means when we're testing our new treatments and so forth, we're not testing our whole population. And also, I told you all those benefits, the access to healthcare and access to the latest advances often happens through clinical research and clinical trials. And so we're excluding large parts of our population from those benefits. So that's why our CTSI and at UB, we are prioritizing trying to engage our entire community in clinical research. And so you can see that people in Buffalo, about 30% live below the poverty level and 60% are low income of Black people in Buffalo. So let's talk about the health disparities that exist specifically and particularly in African Americans in the city of Buffalo. An African American within the city limits dies 5 to 10 years younger than white residents in the same geographic area. So Black folks have a 300% higher rate of chronic illnesses compared to white residents in Buffalo. And you look at those hospitalization rates for these common diseases, heart disease, particularly heart failure, 50% higher, diabetes, 250% higher hospitalization rate for a Black person than a white person with diabetes. And look at asthma. 500% higher population rate. And these numbers come from the Erie County Department of Health numbers. And these are the African-American population is primarily in 6 zip codes in the city of Buffalo. So interestingly, if we look at Erie County, how we hear every year, we are kind of near the bottom of the 62 counties in terms of health outcomes. If we were to remove these 6 zip codes from those numbers, Erie County would be at the top, which means if we as a community are going to invest in improving the health of our community, these are the communities that we need to invest our efforts in. So why do these health disparities exist in African American populations in the city of Buffalo? Well, it's really the social determinants of health is the main reason. So if we were to be able to improve healthcare, in other words, if everyone on the East Side had access to healthcare and access to outstanding healthcare, that would move those health outcomes, improve health outcomes by about 15%. That's all. That's all we can do with healthcare right now. And the reason is these social determinants of health: poverty, educational opportunity. The Buffalo school system is, struggles. Let's put it that way. Structural racism in many ways is the underlying cause for almost this whole list. High unemployment. Black people in Buffalo, and this is before the pandemic, had a 3 times higher unemployment rate than did white people. Those numbers are still that way. But the pandemic kind of changed everything in a lot of ways. Low property values, poor housing stock, limited access to healthy food. Look at the one full service grocery store, the Tops on Jefferson Avenue, serves 89,000 people. One town over in Cheektowaga, 86,000 people. There are 8 full service grocery stores. That's a social determinant of health. That's a systemic problem that we have in our community. Limited access to healthcare, unwalkable neighborhoods, the criminal justice system, access to public transportation. Most housing in the east side of Buffalo was built before 1978, and lead paint was legal until 1978. So there's a lot of lead contamination in the homes on the east side, access to recreational facilities. So these are the kinds of institutional and structural problems that we as a community need to invest in order to contribute to reducing these health disparities that exist in our community. And what we're trying to do in the CTSI is engage our entire population. In other words, by connecting folks with clinical research, then we can help connect them with healthcare. And then, as we think about this, I think we as healthcare providers need to think more broadly about health and the kinds of things that we can do to improve the health of our community. So it's 12:50, and I will stop here, and we'll be happy to answer questions, talk about more of any of the things that I talked about more, and hear comments.
Dr. Murphy, that was outstanding, and a very concise 20-minute walkthrough of the current conditions. Let me get an overview question. We surely have known the statistics that you point to for some time. We've had UB Medical Center, good people in our community trying to solve problems. Do you think there's a newer awareness? Do you think what do you imagine to be the reason we haven't either educated in a lifelong learning sense a population so that they avail themselves of information? What new moment do you think we have through your efforts that we haven't had in the past? Let's put it that way, because we are where we are, and how do we get to another spot? I guess that's my best way of putting it. Yeah.
There we go. Okay.
Good.
I unmuted myself to cough. I muted myself to cough and then couldn't get unmuted. Anyway, I'm done coughing. It was one cough. Okay. You ask a key question. Buffalo is not the only city in the country like this. I mean, we have significant underlying systemic problems. I think there is really not been very much awareness about it unless you think about these things, unless you read about these things. I mean, The city of Buffalo is 278,000 people, and Erie County is what, 925,000 people. And so folks who don't live in Buffalo maybe just don't think about these things so much. I think that, you know, if we look at three events that have happened recently that just shines a spotlight on these issues. And I think this is going to be the things that are going to help us, Dennis, I think, help create an awareness, because I think if we do that, then I think we have people in our community who can invest in solving these very, very challenging and difficult problems. First was the pandemic. And we all know that people of color suffered disproportionately from the pandemic. If we look at the East Side, you know, in the first 8 weeks of the pandemic, the fatality rates in African Americans were 2.5 times the fatality rates of the general population. And there are multiple reasons for that. One is the underlying illnesses that exist because of those social determinants of health. The other is that the kinds of jobs that folks in the East Side have, there are essential workers, they're healthcare workers, they're first responders, they work in the grocery stores, and so they continued to go out and had more exposure during the pandemic because they were essential workers. The second was the tragic racist shooting on May 14th in the grocery store. And look what's shutting down. First of all, it has traumatized our community. It continues to traumatize our community. And then if we look at what it did by shutting down that one grocery store that is present in the East Side, you know, we need the World Central Kitchen here for months. And here we are, an urban area, you know, and we only have that one grocery store. So we have an underlying problem. We need to solve the food equity issue. And then the third is the blizzard. You know, look where I believe it's 20 of the 30 deaths were in African Americans, or in the city of Buffalo. That we don't know all the zip codes yet, but I guarantee you, it's going to be the zip codes on the East Side that suffer disproportionately. They're the last to get plowed. I drive to work every day into this building, which is, I see the fruit belt right out my window. The fruit belt is the last place to be plowed every storm, every single storm. And, you know, that's a policy. Somebody's making those decisions. And those are the kinds of things that need to change, I think. And I think that, you know, the pandemic, the racist shooting, and the blizzard are going to raise the level, the profile of these inequities and hopefully lead to some solutions.
Silver linings, perhaps. Melissa, how are we doing for questions?
We have one question so far.
What?
Could you expand on how the criminal justice system relates to poor health in Erie County?
Sure. So we know that Black people are arrested more often for the same crimes. Well, let me tell you. There are much bigger problems with the criminal justice system that I'm going to tell you about, but I'm going to tell you about this because we at UB became involved in this, particularly the School of Law, folks in the School of Law. So if you look at traffic ticketing by zip code, and you look at, these are for things like tinted windows and expired registrations and so forth. This was happening in, it was actually right around pre-pandemic 2019 or thereabouts. 3 times the number of tickets in the East Side compared to South Buffalo and North Buffalo and other parts of Buffalo. And so the city actually doesn't always share those things. And so what happens is, if you don't pay your tickets, then your license gets suspended. So this is just targeting a community where, when people's licenses are suspended and they can't pay the fees, they can't get to work, they can't get their kids to school, they end up having to drive with suspended licenses. And so this creates an enormous amount of stress And we know that this kind of stress that exists has a very detrimental impact on health. The stress of, a Black person being stopped by a police officer, and then the things that subsequently happen from that. So it is undoubtedly, it being the disparities, the racial disparities between how the criminal justice system treats Black people compared to white people, is a huge stressor that contributes to poor health.
Any others,
And-
Melissa? Go ahead.
Oh, sorry, I did one other one. How can someone learn about some upcoming clinical studies, and what are the requirements to participate in those?
Yeah, very good question. So the requirements are different for each study. Lots of healthy volunteer studies as well. I'll send you a link. I can't talk and find the link and put it in the chat at the same time, but I can send a link. And maybe for when this is recorded, we can add that to that. It has all the active clinical trials that are going on at UB, and you can look at it. You can look healthy volunteer. If you have diabetes, click on diabetes and all the diabetes trials that come up. Click on heart disease. Click on the ones that actually you often get paid to participate in. You can look at those. And all of the active studies at UB are listed in this. And it gives you a short blurb, a short summary of what the study is, and in general, what the requirements are. And you click on a thing, and then someone will contact you if you want more information about it.
I did just drop that link in the chat for anyone who's interested.
Hey, nice going.
Yeah, good. That'll be
Those
part
were,
of the program then, on the archived position too as well, Melissa.
I can put it in the link, yes.
Good.
And those were all the questions that we received.
Good. And I'm looking at some of the folks that are in our audience. You've got this tremendous resource, the university, at so many levels. It interacts. What you're really describing, Tim, strikes me as a design issue. How do you design a community so that you create the very inclusiveness, the diversity, the equity, the justice, if you will, in the design of healthcare delivery, as well as others. So I'm just wondering, how do you end up interacting with the other departments at UB to say, hey, we've got a problem. How can the university help us through lifelong learning? Oh, and by the way, the library system itself perhaps becomes an important conveyor of information at the branch level. There's 37 branches, one in many of the zip codes that you've spoken about. So how do we use the resources at hand, Erie County, and connect them? I'm sure that's going on. Maybe just point to that and describe it a bit.
Sure, great question. So one of the other roles you mentioned that I play, I work with people in the Community Health Equity Research Institute. And what we're doing in the Community Health Equity Research Institute, and really the university is doing, things have changed with regard to the university and its commitment to the community. So you mentioned all 12 schools are involved. That's the School of Law. So we're encouraging through our institute and helping folks in the School of Law to address the criminal justice system inequities. We're working with the School of Architecture and Planning to work in neighborhoods and so forth. The Graduate School of Education to help with some of the educational disparities that are existing and that sort of thing. So that's a thing, that's what the university we're trying to do. And I have to tell you that the university at the highest levels of leadership have committed to partnering with our community. Thus, their investment in forming the Community Health Equity Research Institute. Another thing that we're doing in that institute is we call it our business leader group. And we've had a series of meetings, and we're going to continue with this. The idea, and these are the CEOs of the large firms in Buffalo. And the idea is that it is a smart move, let's put it that way, for these companies to to take into account health equity and racial equity in their decisions. It's not just being altruistic, it's actually to their best interest, because what can happen is we can have a larger workforce, a healthier workforce, a more educated workforce, if companies would actually make their decisions to contribute to health equity and to racial equity in our city. Some other cities are doing that. There's some good things going on in Cleveland, for example, in that regard. And I think there's interest, and this is how we're going to really, I think, begin to make a difference in terms of changing the community the way that you've described, Dennis.
Well, that is good news. Can't undo the past. You can only design the future to solve the problems, especially now that they're being identified. And I totally agree with you on the zip code. I live in 14209, and the TOPS market is in 14208. I think to finish up, I want to hear again that disparity that you mentioned. How many people the TOPS supermarket in 14208 serves versus the population served by TOPS just next door in Cheektowaga.
So the numbers I gave were the entire east side. And the reason I did that is because TOPS is the only grocery store in that east side. So that's 89,000 people to that one TOPS. Cheektowaga is 86,000 people. So it's not just TOPS. There are 8 grocery stores in Cheektowaga serving those 86,000 people. There is one full service grocery stores and a lot of corner stores, which don't have fresh fruit and so forth, and, don't have very healthy food, but one grocery store serving 89,000 people.
And that's a starting point, and it really was highlighted after May 14th, obviously, what happens when that's closed down or through a blizzard. What a great way to start the year. Dr. Timothy Murphy, wellness is a lifelong learning project. Let's put it that way. And especially your 2-minute clip showed a new mother coming to terms with the effects of smoking, and through your efforts, at least showing the immediacy. We're not talking years later. We're talking days later when you see smoking, that there's measurable benefits from doing that for both you and a baby. So that was a great 2-minute clip. We will continue this as the month goes on. We'll have folks from the Erie County Health Department and speaking on the same subject, and we'll do our part here on the Imagine program to keep pointing to wellness as the year progresses. So thank you again for a great presentation.
Thank you for the invitation to be here.
You're quite welcome. And folks, thank you again for joining us today. We'll see you back here on Zoom next Tuesday, if possible. We're going to be listening to and seeing a presentation by Anna Kaplan. She's the executive director of the wonderfully restored Gray Cliff by Frank Lloyd Wright. I'm Dennis Galucki. Be well this new year, and good day.